Hello there, I'm Dr. David Moore, one of the urologists at Deaconess Clinic. I was asked to give this short talk on men's health. The first thing I would talk about is just general men's health. Far and away more important than any prostate or testicular cancer screenings is just general health maintenance. And so cardiovascular disease is a much bigger deal and bigger killer of men. And so surveys have shown that the majority of men are reluctant to seek doctor care and to have a primary care doctor. So the first and most important thing is to just get yourself established with a primary care doctor before issues arise. Things like high blood pressure and high cholesterol generally don't have symptoms, and those are things that can be silent killers. So I would absolutely encourage you all to get a primary care doctor within the Deaconess system. The second thing is just general healthy diet and regular exercise. You hear it from just about every doctor, but for all things men's health related, healthy diet and regular exercise is going to improve things for you. Specific to your urologic health, first we would generally talk about the prostate. You know, that's the gland that surrounds the urethra. It makes most of the components of semen, that's its job, but around the age of 50 it starts to cause problems in men. The two biggest problems are benign, non-cancerous growth of the prostate, that's that BPH or the enlarged prostate, and then prostate cancer. The prostate is the second most common place that cancer occurs in men. And 1 in 7 men are going to be diagnosed with prostate cancer at some point in their life. There are two ways that we identify prostate cancer early. That's with that finger exam that you dread. That's a once yearly exam by your primary care doctor. And then the PSA blood test. That's a simple blood draw that you would also get just once a year. There is some debate as to when you should start screening for prostate cancer. In general, I would say just start asking your doctor about it around the age of 40. And then they can determine if you have any risk factors that would necessitate starting your screening a little bit earlier. In general, all men should be screened for prostate cancer at least by the age of 55. As you get older, into your 80s and even into your 90s, prostate cancer becomes very, very common and very unlikely to harm you. So at some point, we actually stop prostate cancer screening altogether. The second issue then would be that non-cancerous growth of the prostate, or the BPH, and that causes all those bothersome urinary symptoms as men get older, and that's the urgency of urination, frequency of urination, getting up at night to pee, all those things that are not exactly life-threatening, but they're life-altering and they are a major nuisance to patients. Certainly there are behavioral things that you can do to help with that. Caffeine, alcohol, spicy foods, carbonated beverages, those sorts of things are going to set your bladder off and worsen all those symptoms. But 40 million American men are suffering from these symptoms of the enlarged prostate, but only about 10 million are actually under treatment for it. So again, men are underserved in that regard, and so I would encourage you to talk to your primary care doctor about potentially medications. And there are several minimally invasive same-day procedures that are very effective for treating an enlarged prostate that we do within the urology clinic. That's about it for the prostate health. Regarding testicular health, testicular cancer is very common in younger men. In men through puberty, through their mid-30s, it's actually the most common cancer that they will experience. Overall, still not terribly common, but in that age group specifically, very common. And so starting around puberty and extending well into adulthood, you should perform monthly self-exams in the shower or just once a month, where you're feeling for any lumps, bumps, or anything that's worrisome. Generally, testicular cancer doesn't cause pain, and it just presents with a painless lump in the testicle. So if you have any concerns whatsoever, again, just bring that up with your primary care doctor. They'll often order an ultrasound and have you sent to us for further evaluation. The final thing regarding men's health that I would touch on is just self-care and mental health. Mental illness is incredibly common. At any point in time, 1 in 5 Americans are going to be suffering from a mental illness. It's the leading cause of disability in this country. And 75% of all suicides are men. And so again, men are highly underserved in that regard. All patients are. But it's just important to be aware of that, for your friends and family members, to ask questions and never be afraid to reach out if you're struggling. If you have any other questions, schedule an appointment with your primary care doctor or urologist. But I hope this was helpful. Thanks.